Okay. All right. Well, thank you everybody for joining us this morning to learn more about our Healthy Behaviors Initiative Program grant opportunity. Ashley and I will be your presenters today. I'm Dallas Russell, the Healthy Behaviors Initiative Program Officer, and I will let Ashley introduce herself.
So I'm Ashley Stewart. I'm the Director of Programs for the Rapides Foundation, and I oversee all of the grant making and programmatic activities of the Rapides Foundation.
All right, so today we're going to be going over our RFP, our request for proposal, and show you the grant portal, and also we'll have some time for questions.
And so just to give you a little background on the Rapides Foundation, we always like to cover this basic information when we get started. So the mission of the Rapides Foundation is to improve the health status of Central Louisiana. And for us, health status means we want people to live longer, free of disease and disability. And our vision is to positively impact Central Louisiana by deploying our resources to improve the key factors of health status. And we know that there's a lot more than access to care that impacts the health status. And that's why we really focus on those key factors. And we serve 9 parishes in Central Louisiana. Here's a map of what they look like and where those different parishes are located. Rapides Foundation is where our office is, which is right in the middle, but we do serve all of the 9 parishes around the area. And like I said, we focus on those key factors that impact health status. And we have 3 areas of focus: healthy people, which includes healthcare access initiative, and our healthy behaviors initiative, which is where this funding opportunity comes from. Also, 40% of our efforts are in education, because we know that a person's level of educational attainment really correlates highly to their health outcomes. And then finally, healthy communities, which includes our work in economic development and the social environment. For this particular opportunity, I said it's from the Healthy Behaviors Initiative. And for that, we're focusing on 4 specific health behaviors: healthy eating, active living, substance and alcohol abuse prevention, and tobacco prevention and control. Research shows that these 4 activities are very strong contributing factors to most of the chronic diseases that are very prevalent in our community. And so that's why we have picked these 4 particular ones. We have some data to kind of show you to help you understand what data we looked at from our community health assessment. We have And for this community health assessment, this is specifically looking at data in our 9 parishes. It was conducted in 2020. The results were, well, actually it was conducted in 2021. And so this is very current information, kind of right at the end of the pandemic, when everybody was kind of coming out of it. And so we asked many people on phone interviews, different questions about their health behaviors, any of their chronic diseases, access to care. So it's a very large document that you can access on the Rapides Foundation's website to view lots of data specifically on the Rapides Foundation service area. And that data is also available at a parish level. So if you're looking for some information specifically on the parish, that's a great place to look. There is assessments at an adult level, which is the community health assessment. And there's also the YRBS, which is the Youth Risk Behavior Survey, which is a high school survey that asks about youth behavior that is also available at a regional level. So one of the first data points we looked at is consuming 5 or more servings of fruit or vegetables per day. You can see the breakout amongst our 9 parishes. RFSA is the Rapides Foundation service area. US Peers is actually a group of other rural areas. And so we said, hey, are the Rapides Foundation service areas very rural? So we want to have a rural comparison. So that's what the purple US peer column is. And then also you have US, which is just kind of a benchmark to see how we compare nationally. So you can see when we first started this survey, it was at in 2002, about 23% of the population consumed 5 or more servings of fruit or vegetables per day. And then we have seen an increase. And then we've kind of gone back down in 2021. I will say a caveat about this particular data point in 2021, the question did slightly change. And so we're going to continue to monitor this particular data point to see if that drop was due to the change in questioning or if it's an actual dip. And so you can see of those who did not eat fruits and vegetables daily, this pink box says they cite cost, access, and accessibility as the main barriers to not eating more fruits and vegetables. Next, we looked at physical activity recommendations. The part highlighted at the very bottom of the screen actually shows what the definition of physical activity recommendations is and how this number was calculated. You can see from 2018 to 2021, that number has stayed pretty flat, and that only 18% of our adult population is actually meeting the recommended physical activity levels. When we look at excessive drinking, and again, you can see at the very bottom, that yellow highlighted section defines what excessive drinking is. We actually have seen a slight decrease from 2018 to 2021, but we still have almost 20% of the population that is excessively drinking. And then finally, we also have illicit drug use in the past month. We see that when you ask someone to self-report their illicit drug use, that you would expect it to be zero and that actually no one will report, but surprisingly people can be very honest on these type of surveys and do feel comfortable answering the question. So we see that in 2005, about 2% answered that they had participated in illicit drug use in the past month, and we have seen that increase to 3% in 2021, and we assume that it's probably higher since that is a sensitive question. And you can see as you look at the parishes throughout all of these slides that you have great variance and variations between each parish. And so Catahoula shows a high level, whereas Vernon Parish has a very low level for this particular metric. And finally, cigarette smoking prevalence in the Rapides Foundation service area. It looks like about 23% of adults smoke every day or some days. We do have additional information on smokeless tobacco and vaping in that main assessment that I mentioned. And so when we talk about our Healthy Behaviors Program initiatives, we have all of this information. We know the levels of chronic disease in our service area, and we know one of the best ways of preventing and controlling chronic diseases is through addressing these behaviors. We know that there's evidence out there and there's programming out there that shows that if you make choices easy, you make them convenient, and you make them affordable, that it really increases a person's participation in choices that they're making and helps them to make healthier choices. And so, that's why we have this funding opportunity, is to really support the communities in meeting their needs and meeting the needs and the desires of this particular people that you work with. And so with that, I'll turn it over to Dallas to kind of get into the details of the funding opportunity and tell you what we're interested in.
All right, so our request for proposals is to support the implementation of evidence-based and community-driven solutions for preventing and reducing obesity, preventing and controlling tobacco use, and preventing substance and alcohol abuse. So we're looking for solutions that look at local needs and data to drive all your strategy and intervention decisions, and to focus on strategies with a broad reach and high probability of sustained behavior change. Okay, so as mentioned, this funding opportunity is to address 4 specific health behaviors. In the RFP, there is a list of types of projects we're interested in funding, but do please note that your project should address the needs of your community. And just because if you decide to choose one of those strategies, it doesn't guarantee funding. So we're looking to increase access, availability, and consumption of healthy foods, increase physical activity participation through programming and environments. We also just wanted to make sure that we're very clear that applications that propose only capital upgrades will not be considered. Programming must be included in this RFP. And we're looking to reduce tobacco use and prevent initiation, and to reduce substance and alcohol abuse and prevention and prevent underage use. All right, so in order to be eligible to apply, you'll need to be a 501c3 tax exempt organization or governmental entity, and cannot be a private foundation under Section 509A, and you must be an organization that has a presence in our service area in those 9 parishes that we went over. Okay. Sorry, I'll get distracted by letting people in. Did I do? Okay. All right, so this funding opportunity is for up to $100,000 per year for up to a 3-year period, and with a maximum ask of $300,000. We did want to be clear about this, that if your organization has received a Healthy Behaviors Program grant or a Healthy Behaviors Substance and Alcohol Abuse Prevention Program grant, and you're only trying to continue the existing programs at the same level, the maximum ask is $50,000 per year for up to 3 years with a maximum request of $150,000. So the grant term will be up to 3 years with the project start date of July of 2023. And you may only submit 1 application as a primary applicant, but you can be a partner on multiple applications. And this is a 2-stage process. All right, so for allowable costs, staff time, assessment activities, meeting expenses, advocacy, educational activities, supplies and equipment for your projects, communications, and consulting support. I did want to point out that the indirect cost rate should not exceed 10%. And we consider indirect costs as any expenses that are not incurred directly to produce a service or a program, such as, but not limited to, office supplies, postage, utilities, telephone, space costs, insurance, and back office personnel support. All right, to go over our non-allowable expenditures. So in the previous slide, advocacy is allowed, but lobbying is not. So just make sure, I just wanted to note that. And then also we will not, this funding opportunity is not for treatment or counseling. It is for prevention and education. Okay. And then, all right. Okay, so our review process. So we anticipate awarding around $3 million. This is a competitive process, and a review committee made up of the foundation staff and external reviewers will evaluate all the eligible applicants based on the alignment with the purpose of our request for proposals, the capacity and leadership of your organization, the partnerships, clear and measurable outcomes, in alignment with best and promising practices, and it meets a need that the community has identified. Okay, we also may look at geographic distribution, the size and impact of your impact and your reach, and your history as a grantee, the capacity to perform the work, and services to populations experiencing health inequities or disparities. So as part of that geographic distribution, I did just want to mention that we will be looking at what existing services are out there in our service area. And just for an example, we have a Healthy Behaviors Initiative school district partnership grants with all 9 school districts. And if you're wanting to see exactly what those activities are, you can find that on our website. Okay, so we did mention that this is a 2-stage proposal. So the LOI will be due on December 19th, and that's 4 p.m. on December 19th. So do give yourself plenty of time to submit. The full proposal is by invitation only. And everybody who does apply with their letter of intent will be notified either way. Okay. And you're encouraged to schedule a call or a meeting with the foundation staff to talk about what you have in mind with your project. All right, so we just wanted to be upfront about the commitment we're asking for if you are funded. In addition to implementing your project that you propose, we would also require the following activities. So that's monthly meetings with myself, these are informal update meetings. Those won't be required on months that we have other things that we're doing. And then as needed, some capacity building meetings to just provide some additional support with myself. And then site visits annually. We'll like to have twice a year cohort conversations. So meaning everybody who is funded with this opportunity would be brought together to share just information about your project, the successes that you're having, the challenges, resources that you found, and at least one of those will be in person. We will also be offering technical assistance workshops. We will have 4 over the 3-year period. 2 will be in the first year and then 1 each year after. And these topics will be decided on after we see all the applications and where we think the best, what we think is most needed. So, and then also you'll be required to do written reports, and those reports will consist of a narrative, budget worksheet, supporting documents, and evaluation forms. And that is 2 times per year. All right, so now we can get into the actual LOI. So the cover page is just your kind of summary information, contact information, title. I did want to point out the brief description because there's another question that says project description. So how these are different is with your brief description, we're really just looking for 1 to 2 sentences summarizing what your project is. So this is an example here. Organization name proposes to increase physical activity opportunities in whatever city or neighborhood, whatever your target area is, by installing a walking track, fitness equipment, and offer monthly programming opportunities. Could even add on there for adults or whoever your audience is. So that's just an example. Okay, so for your project description, we're just going to go over each question. So describe the problem your project is attempting to prevent and solve, and the issues your project will address. So right here, tell us, are you trying to increase access to healthy foods? Are you trying to increase physical activity? Are you trying to reduce tobacco use? Why is this project needed? What's the problem that you're seeing that you're trying to solve? And please provide some data to support that need. Okay, 2B, explain your project and how the project is consistent with the mission of your organization. So please tell us, the who, what, when, and where of your project. Tell us all about your project. How often will things take place, when and where, and who will be leading the project. So, and how does this fit in with your organization's current efforts? Okay, 2C, what population will the proposed project target, and what geographic area will your program serve? Include the size of the population and other key demographics. We would just ask that you are intentional and realistic on who your target audience is and the number of people that you say you're going to serve. And moving on to 2D. Is there demonstrated community buy-in for your proposed project? If so, has that information been captured surveys, focus groups, conversations. So does the community you intend to serve want this project that you are proposing? Will they use the program or project? Will they engage with it? How do you know they want it? And we would ask that if you do have, surveys or whatever, summarize that information and share the input you have received with us. Okay, so next, 2E, we're looking for you to complete a table. So we want to know what your strategies are. And then, by listing the strategies your project will use and provide evidence, they help communities like yours achieve results similar to what your project is seeking. So in the grant portal, there'll be these little boxes, and what we're looking for is you to describe your strategy, and then what is the evidence to show that it works. So, according to the CDC, similar communities use this strategy, and then why. So is that because the community is asking for it? Is that because of the evidence you found? Just tell us why you think this strategy will work. 2E, describe any partnerships, actual or potential, you are envisioning for this project. So at this point in time, you don't have to have any agreement forms in place. If you do, that's great. You can, submit those. But who is going to be a part of this project? And when we say partners, this can include individuals, churches, schools, service organizations, municipalities, nonprofits, for-profits, businesses, and more. This could just be a community advocate in the neighborhood. Okay, so 2G, describe how the project can be sustained both financially and organizationally after the proposed foundation funding concludes. So just to be clear, what I mean by organizationally is, after these 3 years, what's the culture? What's the policies that have been put in place? What are the processes? Will the changes be integrated into the existing structure? And then on H, identify desired results by describing what your project is expected to achieve in the short and long term in measurable terms. How will you collect and measure impact and indicate how you will know if you are successful? So when we're talking about outcomes, what we mean is what are the proposed changes in knowledge, behaviors, systems, policies as a result of your program or your project? How will you capture this information? What data will you provide? And how will you collect and analyze the data to show the impact you're going to make? And then I wanted to just talk about a resource for a minute. If you want to learn more about evaluation and outcomes, I would recommend that you look at Community Development Works. That's a program of the Rapides Foundation, and they do have recorded webinars in many of these topic areas that you can watch and gain some insight on. Okay, so then let's get to the supporting information that you'll need to provide as well. There's a budget worksheet template that is an Excel document that can be found on our website. A budget narrative, you're just going to type that up in like a Word document, make it a PDF, but we do have a description of what the categories are. And then your tax exemption letter, your 501c3 designation letter, rather, and then your financial information and a list of board members. So here's just a screenshot of the budget worksheet template. So at the top, we're asking you to give us the resources that you have, and then the expenses are below. So, and then please notice that on one side of year 1, 2, and 3 is the Rapides Foundation. So that's the funding you're asking us for, the foundation for, and then the other side is if you have matching dollars, if you have, what other funding do you have? This can be adapted to, you are welcome to change it. So for example, if you are not asking for funding for any existing positions, you can either ignore that or delete it out. We would just recommend you check all the formulas. Let's see, so the different categories: personnel, travel and training, program costs, capital expenditures, and indirect costs. So we would ask that you keep those same categories though, but within that, if you need more or less lines, you can add in those rows or delete them. So this is just an example of what a budget narrative might look like. So it would total each of those categories. You could have a total per year and then the total for the grant term. So for example, say you want to hire a program coordinator. You would tell us, is this full-time or part-time? And each year, how much money would go towards their salaries. Tell us if, this is a newer existing position. So if it's a new position, for example, it's anticipated the person would be hired within the first quarter. And their role would be to implement, all 4 of our strategies throughout the grant term. And they're going to be responsible for, purchasing equipment and getting it installed and coordinating programming. And then, if it's a new position, we kind of would be interested to learn what skills you're going to be looking for in the person you're going to be hiring. So it doesn't have to be long, but just give us that key information to help us understand what these expenses are for. So this is where you kind of add in the detail and break out. So a media cost, your line item on your Excel, would just be a total number. And then under your narrative, you would kind of explain what exactly are those media costs. All right, I just wanted to point out that at the end of the RFP, there are quite a few resources with links. And I just encourage you to take some time and read some of this information and learn about best practices and what other successful communities have done. And there's just a lot of good information there. Okay, let's talk about the submission process. So you can submit your proposal by going to our website, the grants tab, and then looking for that Healthy Behaviors Initiative Program grant. And there's buttons to either start a new application or return to your application. Once you click on that, you will need to sign in. Or you see the button there that says new applicant if you need to make an account. And then you have to enter your tax ID number and just take a quick eligibility quiz. And then once you get in, page 1 is just that RFP information, the general introduction information. And page 2 is going to look very similar to what if you have applied before. It's going to be kind of that cover page information, just the general summary information. However, I did want to point out the process has changed. In the past, if you have applied with us, you would just, for your narrative, upload, a PDF. We are now requiring that you answer each question in the grant portal. We would still highly recommend that you type up your narrative in like a Word document and copy and paste it in. Each box does have a limit on the word count. The RFP should indicate what that is. And also, if you're typing into the box, it will tell you how many words you've used. If you go over, it will let you know how much over you are on the word count. All right, then on page 4, this is where you're going to attach those other documents that we were talking about, your budget worksheet, your narrative, your IRS tax letter, your board information, things like that. And then on page 5, it's for you to review and submit. And you can see, I didn't completely fill out the RFP questions, so it flagged that before I submit. Okay, so now we have time for questions.
Hey, Dallas, I did want to point out a few things about the submission process. There is an option to save and return to it later. So you do not have to, fill out the whole thing at once. So that is an option. And I was going to say, Dallas, if you could go back to that first slide on the submission part that shows where you, start a new application or return to your application. I will tell you, once you start that application, it's very important to use that return to my application button, or not, you will have multiple applications in the system, and that gets very confusing, for you and also for us. So we want to make sure that you do realize that every time you hit start a new application, it really does start a new application. So to return to that application button is what you do once you've already started it. Also, at the very top of every page on the Rapides Foundation's website, on the top right-hand corner, there is a button that says Grantee Login. So you can also access any grants that you currently have in process from that button as well. So once you get it started, you have 2 options. Either you can use that return to my address link, or you can go to the top of the foundation's webpage and click on Grantee Login. So I did just want to point that out to help y'all navigate it easier.
Thank you. Okay, what questions do we have? Please, you can type in the chat, or just take yourself off mute and let us know what we can clarify for you. No questions from anybody?
I have a question.
Okay.
Hear me?
Yes.
Yeah, so this is Tyler Crochet with the Pineville Farm Stand. So currently the Pineville Farm Stand, which I think meets a lot of those missions you're to accomplish, we're currently a for-profit LLC and are looking to switch and operate under a 501c3. If we don't currently have these documents in place, could we file for that tax status and achieve that tax status in time to apply for this grant, even though we don't have years of IRS paperwork or a letter IRS yet as of October?
Ashley, do you know the answer to that?
I am not sure how long the process takes to get your, tax exempt status, but as far as eligibility rules go, you have to have that in place in order to receive a grant.
Okay, so would that be, I need to have that in place by December 17th, or would that be before July?
I'd say December 17th.
Okay.
And then I would just encourage you, there's lots of people on this, meeting here today. I would encourage you to see, maybe there's potential for collaboration if it's not possible to get the tax status in time.
Ashley? Hi, this is Akeisha. Ashley?
Yeah.
Just to add to that, because we have had that come up in the past, where people were waiting on they had submitted an application for nonprofit status. If you have a determination letter from the IRS, then you can submit that along with your application. Otherwise, it would be best to do as Dallas recommended, to try to collaborate with another group.
Could collaborate with like the city of Pineville and let the city of Pineville receive the funds for the Pineville Farm?
Yes, they would act as a fiscal agent for your group, since they would be eligible to receive the funds.
City of Pineville would just distribute the funds to us however we need them.
Yes, they would act as your fiscal agent, whoever you would partner with. But you would have to provide a letter or some kind of documentation to explain that relationship with them as your fiscal agent.
Okay. I think the Natchitoches Farmers Market does something similar, because the Natchitoches Farmers Market, whenever they cut checks, it comes from the city of Natchitoches. I noticed
Yeah.
that.
It's
Yeah,
actually a program I happen to know because I live there and such, but that's actually the city that implements their farmers market there. So it's not a fiscal agent situation because it's actually the city itself that implements their farmers market.
Okay.
Yeah. All right. So Jennifer had a question about financials. So they are not required to submit 990s. How would you handle as mandatory on the application?
Yeah, so for a faith-based organization, we know that you don't always have to have that particular documents. And so it's whatever shows that you're a tax exempt organization.
I think she's specifically asking about the financials. What would be acceptable financials if she doesn't have 990s? So an annual audit or a financial report is also acceptable.
Mhm.
Does that answer your question, Jennifer?
Yeah, I think so. Thank you. Thank you, Dallas and Ashley.
Sure. All right. Who else? Be brave. It's all right.
I have a question. Would these funds be appropriate to be used for evidence-based practices for suicide prevention?
So this, I think the short answer is no. I think that it would be, we have funded in the past, I'll say, evidence-based curriculum for substance and alcohol abuse prevention. So this is not appropriate for necessarily directly suicide prevention. I don't know, Ashley, what did you have to add about that?
No, I think you're right on. I think, for this particular one, it wouldn't align with the RFP requirements.
Okay, thank you.
Jennifer, did you want to speak? I see a hand.
I have another question, if you don't mind. You said when you were talking through that funds cannot be used for treatment or counseling, just prevention and education. So that would include cessation services?
I'm gonna let Ashley answer that one.
Traditionally, especially around substance and alcohol abuse, if you're talking about substance cessation, then no, this is not, these dollars are purely for prevention of treatment. Cessation for tobacco, we usually consider more of a treatment side than a prevention side. If you have evidence out there that the cessation also contributes to prevention, then I think that's a conversation that we can have offline.
Thank you.
All right, anybody else? Okay. Well, thanks all for being here, and you're welcome to reach out for a meeting or a phone call. If you want to just talk to us about what you're thinking. And yes, it looks like we can share our slides as well from this presentation. Okay, well, thank you, everybody. Hope you have a great day.
Thank you.